This is a series of videos explaining the ATLS course. So the ATLS, Advanced Trauma Life Support, this is the care that we are going to give to the traumatized patient. And to these patients, we can graph a distribution which has 3 peaks. So we have 1, 2, and 3 peaks. This is the y-axis. Here we have the amount of people who have died after the traumatized event, and here you have time. So the first peak that we have is exactly at the moment where the lesion occurs. This could be like seconds or a few minutes after the event. Here, the reason for which the people die especially are some lesions to the great vessels, or damage to the heart, like rupture of the aorta, for example, or apnea, severe apnea, or obstruction of the airway, or severe lesion to the brain or spinal cord. The second peak that we have is minutes to hours after the event. So why people that has these severe lesions after trauma die minutes or hours after the event? This is principally because of hemorrhage, which could be because of pelvic fracture, or laceration to the liver or spleen. This could also be because of epidural hematoma, or subdural hematoma. This could also be because of pneumothorax or hemothorax. These are the principal cause of death minutes to hour after the event. And here we have what is called the golden hour, which is the time between the event, the trauma event, until the patient is receiving medical attention or medical care. So we try to minimize this period of time, or this golden hour. It has to be the minimum, which is where we find the patient until we can treat or take care of the patient. So here is one moment where we can affect the outcome of the patient. And the other is the third peak, which is these several days to weeks, could it be, or hours to days, which is after the trauma event has occurred and after we have stabilized the patient. Then several days the patient can die because of sepsis, principally sepsis, or multi-organ failure. And we can also impact on this peak, because depending on how we treat the patient at this moment, which is the moment where we find the patient, how we treat the patient here can impact on how the patient is going to end, or the outcome of the patient several weeks or hours later. So we as the primary care, we are doing to the patient, to the traumatized patient, we cannot have we cannot impact this peak, because this is exactly at the moment where the patient gets the trauma. So at this moment we cannot do anything. Exactly at that moment we cannot do anything. The only thing we could have done, or the patient could have done at this point, could be prevention, primary prevention of the trauma. But exactly after the trauma has occurred, this peak of death, we cannot do anything, which is principally because of great vessel laceration or damage, or severe brain or spinal injury, or damage to the heart, severe damage to the heart. Here we cannot do anything. So we, as primary care of the patient, we focus on this dual peak distribution of death, which is minutes to hours after the trauma event. So why people can die because of the trauma, hours to minutes to hours after this? Because hemorrhage, because pelvic, liver, or spleen damage, epidural or subdural hematoma, or hemothorax or pneumothorax. We can treat this, and depending on how fast we treat this, that will impact on the outcome of the patient several days later. So depending on how we treat patients at this moment will impact the deaths, or we can prevent death at this peak, and also we can prevent death at this peak, because we could have treated the patient here, but maybe we didn't was aware about liver laceration, and days later the patient comes with I don't know, could be sepsis because of peritonitis, for example. Peritonitis because, I don't know, some visceral laceration, some small intestine laceration, which we didn't notice here. So if we would have noticed it here, we would not have had this death at this point. So in the ATLS protocol, what is our task to do is to give primary care to the traumatized patient, and we can impact only in the second and third peak of the trimodal distribution of death. And all the ATLS protocol, Advanced Trauma Life Support, all this is about having a systemized way to approach the patient. So it is not like any new care or new treatment to the patient, or a new way to diagnose a specific disease. It's just how we approach the patient, which is a systemized approach to the patient. And the way we approach this patient is going or thinking in the more severe diseases that can kill the patient, which we're going to say it in the next videos. And then we have like a second assessment, which is now the patient as a whole. But first we need to take care of the potential things that can kill the patient. So the ATLS protocol, the Advanced Trauma Life Support Protocol, is how we focus, or how we approach the patient in a systematized way, starting from the more lethal things to the less lethal things. And this impact on the second and third peak of the trimodal distribution of the death after the trauma event of a patient.